Okay. Good morning, afternoon, everyone, depending on where you are. Thanks for joining us on another fantastic day. It's January 2021 for our Coffee and CEO event from the BACB. Today is going to be a super duper fun one. So I hope y'all are excited as me. Before we get to the main event, though, we do have to do the housekeeping stuff. So hold on. This event is being recorded and it's going to be uploaded into our DBA page after the event. If you're here for CEUs, so you got to make sure to stay in the event for its entire time. We're going to be monitoring the attendance throughout the presentation. After the presentation, a short survey is going to be sent out to your email. It's going to have some questions on there. Just make sure to fill that out. That's how we're going to be able to send you your CEU certificate for one Type 2 Learning CE. After the presentation, I just said that, just kidding. Since we are monitoring the attendance, please make sure that your full name is displayed on Zoom so that we know who you are. If you're logging in through a phone, go ahead and just email us at disseminateaba@gmail.com with your phone number used, your full name and email. And don't worry, I am going to be sending all this info through the chat. And during the presentation, we would love it if you kept your cameras on. It's always such a great experience to see people's faces, especially a time like now. So, go ahead, we would love to see your faces. But of course, the chat's always open. So go ahead and, you can comment or ask any questions you might have along the way. And also, if you can, just go ahead and mute yourself during the presentation to limit the background noise. It's going to help everyone have a better experience. Lastly, if you have ever been to any of our previous CEU events, you will remember me babbling on about our DBA fundraiser for our dissemination grant. And guess what? Our annual dissemination grant is finally here. So if you are a member of our SIG, go ahead and hop on over to our broadcast behavior website and you can apply for a chance to make your dissemination dream come true. If you are not a member yet, you can hop on over anyway and you can see if you're interested in joining us and our mission. And I will be linking our fundraising page and website in the chat. So go ahead, check them out. Now, I think you guys are probably tired of listening to me ramble on. So we'll get on to the main event. Today, we get the fantastic opportunity to learn from the highly esteemed Dr. Rachel Potter. So they're all yours, Dr. Potter.
Okay, thank you. And Gloria, are you already recording? Awesome. Okay, so welcome. Thanks so much for being here. I know there's always interest in dogs and animals and other unique aspects of application of ABA in our field and the type of technology that we are privileged to learn about operant conditioning. So I hope today to convey some of that to you, and I'm going to try really hard to leave time at the end for questions because anytime I present on this topic, there's lots of questions and I want to try to be able to answer those as best I can. So hopefully you're seeing my screen here. There we go. So this is me in the real world when it's not a Sunday afternoon. I am Director of Applied Behavior Analysis and Autism Studies at Mary Baldwin University. What I want to call your attention to here in the bottom left-hand corner, you can see that this presentation has a Creative Commons license. And at the end of this presentation, I have a QR code where you can actually download it. Feel free to use it, use parts of it, don't use any of it. Whatever is useful to you that you want to reuse, you have my permission to do that without having to come back and ask me. So that's what that means, and something to think about as you present to other people. If you are creating things that you're happy to share, you might want to learn a little bit more about open licenses and what you can do to support that. So I wanted to call your attention to that as well. So our learning objectives today, of course, this is for a CEU. So how is this linked to our field so that we can make sure that you're getting a CEU for work that is definitely entangled with ABA. So we're going to talk a bit about operant conditioning and how that applies with the training of the dog. We're going to talk a little bit about shaping and schedules of reinforcement because I think those are the most critical and most important aspects of how this is applied in this way, but we're also going to be talking about working with handlers, because as a service dog trainer, not only are we working to develop the skills of the dog, but it's also critical that we work with the person who is the handler of the dog in preparing them for ongoing training, skills maintenance, and making sure we're monitoring that as well. And because it is so important in our field, we're going to talk about data. We're going to look at some examples. We're going to do some visual inspection of data and talk about decisions that we might draw from that that relate either to the dog or the handler that we're working with. If you have questions as we go, you can go ahead and put those in the chat box. If it's something that, you know, can't wait, Gloria will interrupt me, and that's fine, we can do that, but I'll also have time at the end. But my attention span will not permit me to monitor the chat box and present. So I appreciate the help there. So my role outside of the university in the past, you know, what does service dog training have to do with me and my experience? So I'm the past president of the board of directors for Service Dogs of Virginia. This is a nonprofit based out of Charlottesville, Virginia. And my role with them had been, I am not currently doing this, so I want to make this clear. I do not currently have dogs in my home that are in training, but I serve primarily as an adolescent puppy raiser, and then a volunteer trainer as well. And the reason why I like to work with the adolescent dogs and not the little teeny tiny puppy dogs is my least favorite thing to do is potty train. I absolutely stink at that, and I hate it when dogs pee on my floor. So adolescents, that's for me. And that's also where we're dealing with more of the advanced training, which is of far more interest to me. I would much rather train a dog to flip on and off a light switch than to pee outside. So personal preference, that's kind of where I landed there. So what I want to look at first, and you know, I'm involved in a lot of groups on Facebook, and I see questions from aspiring behavior analysts, and also as a professor, I work every day with aspiring behavior analysts, and I get a lot of questions related to animals and what is allowable or what is not allowable. And so we're going to look at some of these questions together as we begin here today. These are the questions we're going to talk about. And if you're active on social media, I'm sure you've seen these questions. You may have wondered about them yourself too. So we're going to talk a bit about qualifications as it relates to dog training and how that may or may not intersect with your credential as a behavior analyst. Independent field work. I see this question all the time. I want to train dogs. Can I count that as my 1,500, 2,000 hours of supervised field work? We'll go ahead and address that. We'll talk about representation, the ethics code, how that ties into this. And then how to get into this. If this is just an area of interest to you personally and you want to be involved with service dog training, I'm going to give you some advice on how you might go about doing that. So let's take these questions one at a time. The first one that I see a lot is, if I'm a BCBA, does that make me qualified to train dogs? Well, not exactly, but what it does mean is that you have been taught a skill set related to operant conditioning. So because you have a skill set in that area, you might have the ability to apply that knowledge to training non-human species, like dogs in this case, but it's not a certification that designates specifically that you are a dog trainer. And in Virginia, there is no specific organization that governs or credentials dog trainers. To my knowledge, there aren't in other states, but I don't want to speak to other states. But to be able to open a dog training business, you certainly need to be competent, and you need to be able to have people say that you've done that well and recommend your services. But it's not, your BCBA credential does not necessarily mean that you are qualified to be a dog trainer, just that you probably have some good background skill sets that would set you up well for that. So my favorite, I teach our intro basic concepts and principles course at our university. And so one of the things that we talk about very early on are the 7 dimensions of ABA, right? So let's revisit that. For some of you, it may have been a while since you have sort of spent some time with Beowulf and Risley. But if I use my ABA knowledge to train dogs, is that ABA? So let's take a little bit very quickly at a cursory level, because you probably have this in great detail in your university programs. If you look at these 7 dimensions, and these are really brief definitions, I know these aren't comprehensive, these are just kind of short, sweet, to the point. But the hiccup here is on the word applied. So when you studied Beowulf and Risley, when you were in your ABA programs, and you talked about applied as one of those 7 dimensions, you were asking yourself, is the skill taught to the learner of primary significance to that learner? And when we're talking about service dog training, the learner is the dog. That's who you're training. Is the skill being taught, whether it's turning on and off a light switch or handing a wallet to a shopkeeper, are those of primary significance to the learner? Probably not. They're of primary significance to the handler, right? You're teaching the dog that skill to benefit and to be socially significant for the handler, not for the learner, not for the dog itself. And so right there, that tells us that in all probability, the work that you're doing training animals, in this case dogs, is not necessarily going to be ABA, but what I would argue is that you are using the technology and you're using some of these conceptually systematic strategies in training dogs. And so it does intersect, but what you're really using is operant conditioning. And not all operant conditioning is specifically ABA. So I want to sort of put that out here because I think that is a question I get a lot from students that are in my program who know that I have a dog training history. Why isn't this ABA? And why can't I do my field work? Here you go. This is why you can't do your field work with animals. So the Behavior Analyst Certification Board is abundantly clear about what counts as a client for supervised independent field work. And the words you see right there at the beginning of this definition, and this is lifted right from the BACB website and documents, I have the citation there, person or groups of people, not animal. So it could be, if you're meeting all 7 of those definitions, maybe some of the work that you're doing with a handler might qualify, but the work that you're doing with the animal itself, that training is not going to meet the board's criteria for supervised independent field work. And a lot of my students are sometimes disappointed to hear that because they get very excited to learn that they can take this knowledge that they are learning in their program and apply it to animals. Sure they can, but they can't count that as their supervised independent field work. If I'm a BCBA and I train dogs, those are 2 different things, can I market myself as a BCBA dog trainer? So I'm going to call your attention here. This is not the new compliance code. This is from the one that's currently in place, avoiding false or deceptive statement. So just being very mindful that you're not advertising, in particular you're seeing non-behavior analytic services as being behavior analytic. So the fact that you're a BCBA, or in my case, the fact that I'm a BCBA and the fact that I've been a dog trainer are 2 independent things that both benefit one another in terms of my skill set, but they are independent, and I would not advertise myself as a dog trainer who's a BCBA, nor would I advertise myself as a BCBA dog trainer. Very independent, and I think it's important ethically that we maintain that compliance and that we not misrepresent ourselves or our credentialing in any way. So how can I get into this work? How can I become a dog trainer or increase my skill set so I can do that? Well, first and foremost, practice, right? If you have your own pets, pets of friends, neighbors, use their pets to try and learn some of these skills. Volunteer, that's how I got involved. All the dog training that I did was unpaid volunteer work. And I'll share with you a little bit why I got into that and what motivated me to do that. But there are some really great training opportunities that are available. My heart is set on someday going to chicken camp. I don't know if any of you have heard of chicken camp or have been to chicken camp, but I want to go to chicken camp when this pandemic is over. But my understanding is you are essentially, they take a small group of people, maybe a dozen at a time, and you are given a chicken for the week. And this is your chicken for the week of chicken camp. And it's essentially a very intense training on operant conditioning with your chicken. And then when that group leaves, another group comes in and they have their week with all new chickens. So chicken camp is on my to-do list, and maybe it's something you want to look into as well. Karen Pryor, and we will talk about her later, the Karen Pryor Academy, there are some resources and trainings available there. She is, I see a puppy on the screen. Is that Josie? Sorry, got distracted, cute dogs. So Karen Pryor is definitely one of the most known names in service dog training. And on my resource page at the end of this presentation, I'm going to point you in the direction of some other Karen Pryor resources as well. There's some professional organizations you may want to look into. The Association for Professional Dog Trainers is one. read about animal training as much as you can, and then think about apprenticing. So right along lines with volunteer work, but say, hey, I'm willing to give X number of hours a week. I'm really invested in this. How can I help? And that's partly how I got involved into this process as well. So my pathway, I said I'd share a little bit about this, so I'm going to give you some context. So at the time that I began working with training service dogs through this nonprofit in Virginia, I was working as an educator in a juvenile detention facility. So these were detained kids, anywhere from 21 days to a year and a half. And I had heard about this agency, and I thought, well, this would be really interesting. I wonder if I knew they were looking for people to foster some of these adolescent dogs, not necessarily training, but taking them home in the evening and having them live with them. And I thought, I wonder if my employer, the facility, would let me take a dog to work if I did this. And they did, and it was a remarkable experience. So throughout this time that I had dogs, these advanced training dogs, in and out of my home, when they were not actively training, they came to work with me at this juvenile facility. And it was so remarkable. They weren't there in a service dog capacity, they were in training, but it was so remarkable to see the youth that were detained, not only enjoying the company of the dog, but what I didn't expect was the youth observing the security personnel and observing our warden playing with the dog, and how humanizing that was for them to see, the same person who, maybe had to, lock them in their cell that morning for some kind of behavior, now rubbing the belly of a dog in the hallway. So it was a very humanizing experience for all involved, and that certainly motivated me to continue in that role. So I did a lot of work with community socialization, taking dogs out in public. Again, I didn't work with the young puppies. This particular organization changes the homes of the dogs in training about every 6 months, with the usual training period being about 2 years. And the reason they do that is so the dog gets used to homes with stairs, homes without stairs, homes with kids, homes without kids, homes with bearded men who wear hats, homes with elderly people. They want the dogs to be able to experience so many different types of stimuli, because that will help determine what kind of a service dog that dog is going to be in the end. So I worked mostly with adolescent dogs that were between that 6-month to 18-month period. We did engage in client handler training. I mentioned before, that's a really important piece. You're training the dog, but you're also training the person who's going to receive that dog so that they can best use that dog to their ability to be able to help them with access in the community. I did become a little involved later, once I was a board member and later board president, with screening applicants who were applying for service dogs. I do want to note the organization, I've mentioned that they were a nonprofit before. And what that means is that these clients who were applying for dogs were not asked to pay for the dogs. It costs anywhere from $40,000 to $50,000 to raise and train a service dog. But we as an agency do not charge the clients. It's all fundraising and grants. Dave Matthews Band actually is a significant donor to this organization and has provided a great deal of support. But that's something to look for if you're helping a client that you're working with who's looking for services. I think the most reputable agencies are going to be those nonprofits who engage in external fundraising. Their mission is a little bit different in terms of how they're addressing this. So I wanted to share that. So now the fun dog stuff, that's why you're here. You want to talk about dogs. You don't want to talk about Bear, Wolf, and Risley, I'm sure. But let's talk a little bit about the difference between some of these key terms, because among many people, not all people, and maybe some of you, but maybe not, there is some difficulty discriminating between some of these terms. So service animal, therapy animal, emotional support animal, and pet. So what I have for you here on the next screen is a table that outlines how to distinguish between these two. And again, for those of you who came in late, there will be a QR code at the end of the presentation. So you will have access to this yourself, and you can manipulate it, reproduce it, use it if it's useful to you. So keep in mind, who owns the dog? That, is going to be pretty consistent throughout. Who is benefiting from the dog? And this is where I think therapy dog, a lot of people will, ask if I'm out training with a service dog, he's got a service dog vest, oh, is he a therapy dog? No, because if he was a therapy dog, he would be training to serve somebody else, somebody who goes into a hospital or maybe goes into a school, goes into a clinic, goes into a treatment center. The therapy dogs generally are not there to benefit their owner or their handler. Their handler takes them into other public domains to benefit others. So that's the big distinguisher there. There is no federal law that has to do with training or certifying. So if you are a handler of a service dog and somebody says, prove that there's a service dog, there's no law, there's no federal certification, there's no license. And there are, unfortunately, online, there are places that sell them. You can buy certificates and you can buy ID cards that say your dog is a service dog. And while it may be helpful sort of at a glance for somebody, there's no regulation. You could do that for any pet. And it's this weird profiting thing that really doesn't benefit dogs and it doesn't benefit society either. The big difference here having to do with tasks. So a service animal must be able to do tasks to mitigate a disability. And so as a service dog handler, and the same rules apply to dogs in training, at least in Virginia, as they do with dogs that are in service. So if I have a dog in training with me and I were to enter, say, an airport, and I've flown with service dogs before, I cannot be asked, what is your disability? What I can legally be asked is, ma'am, can you please tell me what tasks that dog engages in to mitigate your disability? That is absolutely an allowable question. They can ask what the tasks are. Now, if I answer, well, you know, when this dog is with me, I'm a diabetic, and if I become hypoglycemic, this dog uses scent to be able to alert me to that in advance of an emergency. Well, sure, in answering that question, I have probably divulged what my disability is, but they cannot ask that. Now, if I answer, well, I'm getting ready to board an airplane, it's a really stressful experience for me, the comfort of my dog is really important to me so that I can safely and calmly fly. What that probably tells the airline is that that might be an emotional support animal, because providing comfort is not a task. It's certainly something that animals do, and as a pet owner, you bet my pets provide me comfort. But providing comfort and engaging in a task to mitigate a disability are two very different things. So I'll skip ahead a little bit here. So now we're going to get in, you're going to meet some of these dogs, and I'll tell you a little bit about them and why we select the kinds of dogs that we do. But this particular agency works solely with physical assistance dogs, so primarily individuals who are in wheelchairs or perhaps cane dependent, need balance assistance, diabetic alert, autism support, and more recently PTSD support with some veterans who are returning from service. And so again, we're training service dogs. We're not training emotional support dogs, though I will tell you some of the dogs that fail out do end up becoming emotional support dogs. But what we're doing in training service dogs is we're making sure that for each of these four categories, we are training, again, tasks that specifically mitigate a disability so that somebody can have increased access. So Tucker here is one of our dogs that we've trained in the past. With his client going through what we call training camp, which is a 2-week period where we're transitioning the dog to the client and training the client. We use behavior skills training. It's the same thing that we use in ABA when we're training our clients, with providing that modeling and feedback as well. And so the two types of dogs, I get asked this quite a bit, what kinds of dogs do you train? Primarily English Labs, and I'll tell you why in a bit. Once in a blue moon, we'll get a mixed breed dog. That's not typical. We have specific breeders we tend to go to. So mostly English Labs, and then once in a while we have Great Danes as well. And Great Danes are so much fun. They're huge and massive and sweet loves. But why labs? So labs are pretty easy to care for. They're easygoing, they're friendly. The fact that they have that floppy ear means they are generally not perceived as threatening in public places. So when you're in places like a mall or a restaurant and somebody else walks by who has nothing to do with you, that floppy ear, we tend to perceive that as being a more friendly dog and less threatening. Labs also, if you've ever had a lab, they are so motivated by food that there's no question what reinforcer you're going to be using when you're training these dogs, because it's going to be food. I can tell you, labs would eat nonstop if you would let them. So That's why they're very effective and easy to train. Great Danes, so this dog is Murphy. Murphy's one of a PTSD dogs that's with one of our veterans, a veteran of foreign wars in the US Navy. And we use Great Danes for a couple of things. In her case, PTSD, and we'll talk about some of the specific tasks that Murphy does. But Great Danes are also good for physical assistance. So if you have someone, particularly maybe a younger person who has a degenerative motor skill deficit, which they're, you know, if you're 23 years old and you're starting to have to rely on a cane or a walker, that can feel very socially isolating from your peers. And when you can exchange that for a dog and everybody wants to come up to you and engage with you and be social with you, that can be a very empowering experience. And so we do use the Danes for physical assistance. They're extraordinarily gentle. Unfortunately, however, Danes are not as food motivated. Danes could take or leave their dinner and have it later. And so we often have to find other reinforcers, usually in the forms of toys or attention, lots of belly rubs, ear scratches, and that sort of thing for the Danes. So we do recognize that the training process is going to be a little bit different depending on the breed. So what do we use? Pretty simple. We use clicker training. So I have one of these little clickers here. It makes a little sound like that. I have these on keychains and in pockets, and half the time they end up in my washing machine. But we use clicker training. If you want to learn more about clicker training, Karen Pryor, who I mentioned before, is sort of the goddess of clicker training and has some great resources out there. But the click itself serves as a signal when the dog has engaged in the behavior that they have been asked to do. Clicking immediately upon engagement of the behavior, what that signals to the dog is not, oh yay, I did that right. What it signals to the dog is, ooh, treat coming, or the reinforcer is about to come. So it's simply a signal that says, because of what you are doing right now, as I click on this, you're gonna get that treat or you're gonna get that reinforcer. So the dog wants to hear the click. So we use clicker training to signal reinforcement is coming for a desired behavior. And then of course your dog and whatever you're using for reinforcer. In this picture here, you will see that instead of being handed a treat, I think Tucker has like this little machine. We got some engineering students over at the University of Virginia, which is also in Charlottesville, to make this little contraption. And you can see that the client, her thumb is on a lever. She doesn't have the motor skills to quickly be able to give her dog reinforcement when trying to maintain skills. And so she has this neat contraption that these engineering students set up where she does have the skill to be able to push on that lever, which will then release treats for the dog. So we're modifying equipment. We're working with local university students. We're doing what we can to meet the need of the dog and the handler so that that reinforcement can be ongoing. So operant conditioning, again, that's what this is all centered around, and primarily through positive reinforcement, right? The dog does the desired thing, and then here's that click again to the dog. All that means is treat coming or belly rub coming or ear scratch coming, whatever that is, in most cases food. And here we have Ellie. Ellie's actually a therapy dog. Ellie is not a service dog, but she's one of my favorite dogs in the world. She's a big love. And so positive reinforcement, again, with this click signaling, it's coming, right? Extinction, we're doing this too, right? When the dog is engaging in the behavior we do not want them to do, there's no cookie, there's no click, there's no attention, there's no escape from demand. We are using these same principles that we use day to day as behavior analytic practitioners, only with the dog. So we might be putting the dog's behavior on extinction. Shaping, this is how we begin most of our skills. And I'm going to talk a little bit about what we call touch and mark, which are how we begin training, sort of those first steps. But when I'm training a dog, for example, to use their paw to turn a light switch on and off, I want them to get closer and closer. And so I'm again going to be using this clicker and treats for closer approximation. So in the beginning, it might be that the dog approaches the wall where the light switch is. I'm clicking, I'm treating. Now the dog is leaning against the wall or putting their head or their paw against the wall, clicking and treating. Then eventually, I do that a few times, but then the dog's realizing, wait a minute, I'm not getting that treat anymore. It must be something else. Maybe it's this thing on the wall. Maybe I should paw at this thing on the wall. Dog paws at the wall, paw anywhere on the wall, even if it's not the light switch. Click, treat, click, treat. We do that for a while. All right, now that's not enough. Let's raise the stakes. Now I want the paw actually on where the light switch is. And so we move it step by step through shaping those closer and closer approximations with clicker training. Schedules of reinforcement, absolutely critical. Non-contingent reinforcement is something that is extremely valuable in training dogs. Primarily, we use this as an antecedent intervention. I have used this a lot with teaching loose leash walking. You don't want to have a service dog that's got that tight leash that's pulling away from their handler. They should be right at their handler's side. And so, you know, as you learn about the dog that you're working with, and you learn that maybe after about 20 or 30 seconds, that dog has a tendency to veer and pull on that leash before you get to that point, treating the dog. So providing that reinforcement before there's an opportunity for that behavior. We do this with teaching dogs not to be reactive or barking, because a service dog doing that in a public domain is not appropriate, and could be reason to be asked to leave, say a restaurant or a shopping mall or something like that. And so what we do is we cue the dogs actually to look. If I'm by my window and I see another dog walk by and I can tell that my dog's getting ready to bark, I'll tell my dog to look at that, click, treat, don't look at that, click, treat. Anything but barking, but I'm constantly look at that, and reinforcing, and eventually the dog will pay attention to that other dog walking by, but will not be reactive and will not bark. I do want to say, though, that can be breed dependent. There are some breeds that are more likely to bark. If you have a beagle, I'm sorry, this will never work for you. So be mindful that some dogs, terriers, as well, hunting dogs, it's going to be really tough for them. And that's part of the reason why you don't see a lot of terriers or hunting dog breeds as service dogs. You're going to tend to see dogs that are going to be more responsive to training not to do this. Fixed ratio, 1, continuous reinforcement. When you're training that new skill, every time they engage in the skill, right? It's the same with kids that we work with in the field. Start with a very thick schedule of reinforcement and gradually wean off of that onto a thinner schedule. Eventually, you want your schedule of reinforcement to be variable. So you're not always clicking and treating the behavior. You're sometimes clicking and treating the behavior. For intervals as well, sometimes you're working on things that involve a duration or a period of time. In that case, doing the same with more frequent, thicker schedules of reinforcement, moving on to thinner schedules of reinforcement would be very appropriate. So here are just some examples of what we're measuring, and it could be numerous other things depending on what you are training the dog to do, but I wanted to give you some very concrete examples of what we've done. I've talked about turning on and off lights because that's something that we train a lot. So we might be interested in latency. After I give a dog a cue to turn a light on or off, how soon before that dog begins to engage in that series of tasks that leads to the light being turned off? We might also be looking at percent accuracy. So there are some cues that we work with dogs that are very similar, and up and on is a good example. So the way we train, and different trainers do different things, but the practice with Service Dogs of Virginia is that up and on do not mean the same thing. So if, let's say that I am a wheelchair user and I'm in a store and I want my dog to hand a wallet to the shopkeeper, I'm gonna get the wallet to the dog and I'm gonna cue the dog up. And what I mean is for that dog to put 2 paws on the counter so that the shopkeeper can reach, grab that wallet. If I were to cue that dog on instead of up, that would be bad news, because I can tell you that dog will jump on the counter with all 4 paws. So we teach on means 4 paws and up means 2 paws. So that distinction is really important. And when dogs are learning that skill, it's critical that they use the right one, because we don't want dogs jumping up on counters on shops, right? We want them to be able to distinguish that 2-paw versus 4-paw cue. And so those words up and on, we might be looking at accuracy of the dog being able to distinguish between those cues, maybe if they're alternating or in random order during a training exercise. Duration, so putting a dog in a stay position, we might be measuring how long they will stay in that position before being released. When dogs are particularly young puppies, attention span of a gnat, they can't do this very long, but over time, a dog should be able to do this for an extended period of time. Sometimes we'll use other cues to help them. So one of the dogs that I was most involved with, Louis, and I think I have pictures of him later, I had this little frog-shaped bath mat that I carried everywhere I went. And Louis knew if that mat was on the floor and he was in a down cue, he had to stay on that mat. So not only did he have the cue to stay, but he also had that visual tactile cue of stay where exactly, and that was Louis' frog mat. So the first two cues that we work on, other than just general socialization and good behavior, are what we call touch and what we call mark, which are nose positions. Because almost all the tasks, because remember, service dogs have to engage in actual tasks to mitigate a disability. Dogs can use their faces or their noses to engage in tasks, and they can use their paws to engage in tasks. So it's very important to teach the dogs on command to be able to use those parts of their body so that you can then work into shaping some of those other specific behaviors, like turning on or off a light switch. So the touch cue is a nose. We do it, again, different trainers do it a different way. It's a nose to 2 fingers. And that is our way of explaining to the dog where we want their head to be. So in the beginning, it just becomes a game, right? You put your nose on my 2 fingers. This is just a game. Touch, touch, touch. But then gradually that nose might be pulling on a different item. So one of the items, I have it here. I don't even know what this is called, but it's made of vinyl, so it kind of feels like a tent, and it's shaped like a hot dog, and it has Velcro across the top here. I've also seen them with carabiners, and you might have a client wear this on a belt loop. Eventually, this might be something where you're training the dog to tug with their mouth as an alert. So before you're training them to tug it with their mouth, you would want them to work on touching it. So eventually it becomes, you know, touch my fingers, touch my fingers, touch my fingers, and then you're indicating touch, and then eventually the dog will just touch the item. This is something that we used with a client who had autism, and the client, who at the time when we were doing training, was about 6 or 7, so mom was the handler, not the child, but mom and child and dog would go out, and the child would wear this, and we taught the child to call it his stop and think. And it could be anything from, they're getting ready to cross the street, and instead of the mom always having to say, stop, wait, don't, because I can tell you, you know, you guys know, you don't like using those negative words whenever you don't have to. Instead, the parent was taught to cue the dog, and all the dog would do was tug. And whenever the dog would tug on this, the kid would go, stop and think. And then the kid was able to go, oh, we're at a crosswalk, or, you know, maybe I'm talking about something and now I need to be quiet. But it gave the child an opportunity to reflect on their behavior without the parent having to say, stop that, don't do that, wait just a minute. We were able to increase independence of the client. So this is pretty cool. So in the beginning with this touch cue, again, having that FR1 ratio and then gradually thinning that. Shaping, usually we would begin teaching without any kind of verbal cue at all. We would begin shaping only with visual cues and add the verbal cue of touch later. So mark is the paw position. So you've had the nose position, now the paw position. And this would begin with an X indicator, usually on a floor. This is just painter's tape. I could have put it on the carpet, but just for illustration, I have it on a little piece of cardboard. So again, think about that dog that's learning to turn on and off a light switch. That, you know, X becomes on the floor, you're teaching that mark cue, so the paw goes there. Now eventually that cue goes next to the wall, then it goes on the wall, then it goes a little bit higher on the wall, then it goes next to the light switch, then it's on the switch. And so teaching this notion of sort of an X marks the spot for your paw is the next most important cue that we teach. So touch and mark are the 2 that we teach at the very, very beginning with our dogs. Things to remember, contiguity of reinforcement. So you want to make sure you're reinforcing the dog as soon as possible after that desired behavior is displayed. That is no different than when you're working with clients who are learning a new skill who are human, right? Same idea, contiguity of reinforcement. And then also the density of the reinforcement schedule. So if your schedule is too thin, you're not going to be reinforcing the skill the way that you want to. You want to make sure you're starting with that thicker reinforcement and gradually thinning that. And then preference assessment, right? We do this with our clients and patients all the time and our students. If it's not reinforcing, don't use it. I can tell you the lab, that food, that's going to be reinforcing. But for some other dogs and other breeds, find what works for them. It could be attention, it could be a particular toy. It's not necessarily going to be food, though that's usually where we will start in the hierarchy. So preference assessments with the animals that you're working with as well. So let's look at some data. I'm showing you data, but I'm also telling you that when we train dogs, we typically don't do this. We typically are not writing down our data. We're typically not graphing it, or we might do it once in a while just as kind of a spot check. But most people who are dog trainers aren't taught this particular skill set. But I thought it was kind of cool as we were working with some dogs on some new skills to take a look and graph it and see what that might look like. So in this case, we were working with a canine who was doing some scent training. So this canine was being evaluated to see if they would be a good fit for a client with type 1 diabetes. And what we had was a piece of cloth that client had worn when they had had a hypoglycemic emergency. We asked them when they have those kinds of emergencies, if they don't have their dog yet, to keep whatever shirt they were wearing closest to the body. And we literally cut it up into little pieces. We keep them in the freezer. We use them for training. And in the beginning, what we want the dog to do is be able to locate and identify the scent. And so you can see here in each of these 3 sections, we changed what the expectation was. So of 30 boxes, we would have this little piece of fabric with a scent in it in one of those 30 boxes. And when we first did this exercise, those boxes were left half open to make it a little bit easier for the dog. And we're in a smaller area, so only 400 square feet. Then gradually we work still 30 boxes. The scent is still only in one. Now we're closing the boxes for the dog to identify. Same area, 400 square feet. Now for the 3rd section here, now we're increasing the square footage. So what we're doing here is really taking a look at, is this dog going to be a good fit? Do they have good scent skills? This is not how we would actually train them to alert. There's more processes involved in this. This is the process of evaluating a canine to see if they would be a good fit for this type of work. Not all dogs are great at scent work. Here's another example. So in this case, what we're looking at is the down command. So down is different than sit. Down means chest on the floor and all the paws. Sit would just be the bum on the floor. So in this case, what we're looking at is how the dog is doing in terms of their accuracy when they're getting the visual and verbal cue together, the verbal cue alone, the visual cue alone, or some random intermixing of those cues, because we want the dog to be able to be responsive to those. At this stage of training, we haven't necessarily identified the client that this dog will go to. So we don't know if this is going to go to a client who might not be able to give a visual cue because maybe they don't have the motor skills to be able to do that. Or maybe this dog might go to a client who doesn't have the ability to give a verbal cue and can only give a visual cue. And so we want to make sure that the dogs are adept both ways. So loose leash walking is ongoing. It seems that the training for that never ends. Again, you don't want the dogs pulling on those leashes. On versus up, I talked a bit about that. So for us, the distinguisher is 2 paws versus 4. Go under, through, and back. So walking through something narrow like a metal detector, training the dog to go ahead of you, to turn around and then back up so that you're coming in behind the dog would be important for going through narrow spaces. And then we have client-specific tasks. So at this point, once we've mastered a lot of these general tasks, general socialization, the first 3 things here, now we're starting to think about what kind of client or a client with what kind of disability is going to be receiving this dog, and what are the individual skills that that client might need. Is it helping to remove clothing, like pulling off socks, or in the case of Murphy, the PTSD dog you saw before, he has a cover my 6 cue, where the veteran who has this dog is very wary of people coming up behind her, and she'll cue the dog cover my 6, and he will stand behind her and he will change his positioning if somebody's approaching her. And I don't mean approaching her aggressively. She could just be walking through the grocery store and somebody's coming up behind her, and it just is comforting for her to know that he's behind her covering her 6. So we talk with the clients, and in the case when clients have caregivers or parents, we talk with them as well to identify what the priorities are, again, for tasks, because to be a service dog, you have to provide more than comfort or peace. You have to engage in tasks to mitigate the disability. Behavior skills training, I mentioned we use with the clients and handlers as well. We have this 2-week training camp, which basically is exactly that. Instructing them, modeling, giving them a chance to replicate that feedback and cycling through that over and over again. We want to make sure that the client or handler is ready to receive a dog. Placing a dog with a client that's not ready for it isn't going to be good for anybody involved. And then providing that ongoing reinforcement for the client to know that the work that they're doing with the dog is good, because the training doesn't end. When we have that 2-week training camp, there still has to be skill maintenance. We need to make sure that the client or the handler is going to be ready and prepared to engage with that. Here's a handler data example that I'll show you so you can think about what conclusions you might draw. I talked about with the clicker that it's really important to click exactly at the moment the desired behavior occurs. So that is the blue line here. So this is a new handler who is in training camp. And you can see her accuracy of clicking on time did improve with each day of training camp, as well as ongoing post-training camp. But then what I want you to see is that red line. So it was really important. Remember, I said that this click signals to the dog that reinforcement is coming, and that reinforcement should happen as soon as possible when that click happens. And our goal for this client was 5 seconds or less between the click and the treat. And in this case, there was some improvement, but the accuracy really centered right around 40% and kind of stayed there for this client. But I also want to give you some context, because when you look at data, if you don't have the context, sometimes you might question it in a different way. This is a client who had limited fine motor skills, had stronger motor skills in one hand than the other. And so had one hand, her stronger hand, she was able to use the clicker. But that left her with her weaker hand to be able to provide the reinforcement. And so it took her longer to be able to push that lever release for the machine to essentially spit out the treat for her dog. So for this client and this client's needs, this was useful for us to know as trainers, because it meant that we needed to make sure that the dog was going to be patient and that this dog was going to continue to maintain their skills despite a longer delay between that for that contiguity of reinforcement. Annual home visits, we want to make sure that they're continuing to do what they need to keep the dog's skills right on target, use behavior skills training again, and continuing to provide the handler client positive reinforcement for their work with the dog. Here's some recommended resources for you. I mentioned Karen Pryor. She's on here again. I love, love, love the book, Don't Shoot the Dog. It's an oldie but a goodie. There's newer editions of it, but and it's pretty light reading. Like, it's useful, but it's light reading. There's also an excellent podcast called Drinking from the Toilet. And one of my favorite things about that podcast, having nothing to do with dogs, is one of the episodes, I think it's 40, is about CMOs, which as an ABA professor, my students struggle with remembering CMORs and CMOTs and CMOSs. And actually, it's this podcast that gets them to remember it. So, so highly recommend it, especially if you're working with others or supervisees who are struggling with CMOs. Again, nothing to do with dogs, except for the fact that the podcast is about dogs. But there are some good resources for you. So remembering, you know, of course, the client handler is not necessarily the client. I mentioned the individual with autism we had, that's him there, Eric, and his dog Louie. In that case, Eric, as a minor who didn't quite have the skills, the handler was the parent, not the child. Having a service dog takes work. So sometimes people think it's going to be an easy fix. You know, my home life is going to be so much easier if I have a service dog. It's also like taking a 3-year-old everywhere you go. And if you've ever had a 3-year-old or been around 3-year-olds, they're kind of a pain in the ass. So you have to be willing to understand that having a service dog is going to be work on the part of the handler. It's not just going to be an easy solution. Distinguishing between service dogs, therapy dogs, emotional support dogs would be important. And this is the QR code as promised. So if you want access to this presentation, pull out your phone and find the link to that. And because this is under a Creative Commons license, you can manipulate it, use it, credit me, but feel free to use whatever parts of this are helpful to you as you teach and train others. And that is what I have in terms of didactic presentation, but I am happy now to take questions.
All right, Dr. Potter, I hope you're ready because we had a flood. So I am,
Oh, good.
yes. Okay, so I'm just, because we only have 7 minutes, so I'm gonna go wild over here. So I'm just going chronologically. So hopefully we'll get to all of them. Krista asked, she is a BCBA for a 4-year-old learner who is going to be getting a service dog within the next few months. The dog is going to be trained to manage or block certain behaviors, especially SIB, and she wants to assist her learner as much as possible. Is there anything she can do or should do to better prepare for this? And how can she better help her client?
That's a great question. And again, every training agency handles things differently, but for the agency that I was involved with, what I would have loved in that scenario would have been for you to ask if you can attend part of training camp. So there's going to be some type of training that the parent, in this case, I'm guessing, will have on working with the dog. If you can sit in on part of that or be involved in part of that, that will help you understand, because if you're also going to have an expectation of reinforcing the dog's behavior in the work that you're doing with a client, that will help you understand what the expectation is in the way that that dog has been trained.
Perfect. And then Valeria also asked, near the beginning, she was asking, is the selection of the breed also related to the lifespan of the breed?
Not necessarily. And a lot of service dogs actually retire before they die. It gets to a point where dogs, as they become elderly, are no longer able to fill their need, and so they retire. In some cases, when they retire, they might stay with their client or family, and in some cases, we find retirement homes for them, people who are willing to adopt elderly service dogs who are exceptionally well behaved, but no longer able to carry out their tasks. We do engage with Dane, and I'll mention this with Great Danes in particular, because Great Danes do not have as good a lifespan as Labrador retrievers. We do a surgery, I don't know what the fancy name is for it, but basically Danes, when they run, can flip their stomach and their internal organs. And there is a preventative surgery that can be done that essentially surgically sutures the stomach and those internal organs so that that's less likely to happen. And that, has a tendency to be among the leading causes of death for Danes. So that preventative surgery can extend the life there too. But generally that's not a particular concern, because we're starting with these puppies as young as 8 weeks.
Gotcha. Oh, did not know that about the stomachs. Whew. Danielle asked, what happens if someone needs a service dog but is allergic to pet dander?
That's a tough one. So yeah, you have to decide what's the worst of two evils. Certainly there are some shampoos and, dog care that might make that easier. But pets, yeah, that's going to happen. There are certainly some dogs that are less allergenic than others. White West Highland Terriers happen to be one of them, but they do not make particularly good service dogs because they don't train pretty well. So finding the balance of, what's going to do the least harm but provide the most benefit. Service dogs aren't for everybody. They might benefit just about anybody, but they're not going to be a good fit for everybody.
Got it. All right. And then Josie asked, I'm interested in resources or information on distinguishing for the dog when he is working versus when he's not. Right now, I'm only using his harness as a cue.
Absolutely, and that's actually the most commonly used cue, is when the dog is dressed in their service dog harness. That is part of the reason why, even though we start training puppies as early as 8 weeks, they start wearing a harness at 8 weeks, because we want to set a tone for distinguishing behaviors that are okay in a harness versus behaviors that aren't. And when they're young, we actually over-exaggerate when the harness is off. Let's engage in some rough and tumble play, and let's lay on our back and rub our bellies, and we try and really over-exaggerate those so that the dog understands this is associated with when I don't have my harness on. So stimulus discrimination, right, in the ABA terminology. But yes, the harness is exactly what we have always used to distinguish that.
Perfect. And then Sarah asked, what if, unfortunately, the dog shows aversion to the click, even if it's paired with edibles. It sounds like she's been working on trying to desensitize her dog for over a month, even with dinner. He's a rescue and got him from 2 other homes between 4 to 8 weeks old. Is it worth it to try and continue to try and desensitize and repair the clicker with reinforcement, or is there an alternative to the clicker?
So it's a yes and both. So I would continue to try and provide some pairing for desensitization, but I will tell you that we have worked with dogs before that do not respond well to the clicker. And what we use in place of it is, because you want to have a sound that's distinguishable from other regular speech and communication that they might hear in the environment. And so we would use a sound that sounded just a lot like yip, because you typically don't hear a yip when you're out. The problem is a lot of the trainers and handlers feel very uncomfortable being out in public saying yip as they're going through those exercises. But if you're able to use that in the beginning for training and then fade that so you're not having to provide that cue quite as often, that can be done as well. But that's the only alternative that I have worked with, other than, again, just pairing for desensitization.
And Christiana also says there are soft clickers available.
Yeah, there you go.
Yeah. And then we did have a private question that was asking, have you ever successfully trained a dog to be a service dog who was born with a disability or blindness?
No, I have not.
It's an easy one.
In all probability, through an agency, a dog with a disability would likely be disqualified pretty early on. We pick the puppies very carefully. So I mentioned for the labs, we use particular breeders, and we'll go visit the puppies. And these breeders that we use have an agreement that we essentially get the first pick of the litter. And then sometimes not often, but we'll breed within our own. We want the puppy that's sort of the lazy in the corner, not paying a whole lot of attention puppy, which is great because for the breeder, the families that are going to adopt puppies, they want the lively, perky, playing, chasing my tail puppy. We don't want that puppy. we want the lazy, laid back puppy. But we would probably disqualify a dog with a disability. We also work with the University of Pennsylvania's veterinary medicine clinic for annual ophthalmology visits. And let me tell you how much fun it is to have a dog's eyes dilated. It's just like when you go. But we will disqualify a dog if there are disability issues on the part of the dog.
And then Sarah Bennett asked, do you use any gestural prompts with the 4-paw versus 2-paw? This is for the up and on. Is there a physical/silent gestural prompt to pair with the words?
So that may depend trainer to trainer. For us, up was a motion like this. So 2 paws would be up. And for us, on was almost like a clamshell, right? And so that's how we would distinguish up, on, and pairing that with the verbal cue. Again, we want the dogs eventually to be able to respond to either and not rely on them both.
And then Cassandra asked, where do you start with when teaching a dog to do deep pressure therapy? Would that be touch/mark, or would that be something else?
So that is something that we do, particularly with our clients with PTSD and with autism. And so beginning with, usually not the client at the beginning, usually it would be another trainer sitting on the floor, lying on the floor on a couch, and positioning the dog so that in order to reach touch, they actually have to walk across the client, essentially. And then when the dog has walked across, is being reinforced for the touch over here, then cueing them into a down position at that point. And then eventually we repair that with another name so that the dog knows that that's what we're looking for. And usually the positioning that we ultimately try and look for is a hip to shoulder. So it's not compressing all the inner organs kind of at the same time. There are certainly safety matters. Just as you know, if you're working with kids that sometimes require some level of physical intervention, obviously we're very conscious of how we position kids when we need to do that. We are likewise very aware of that when we're positioning dogs on top of children. That becomes very important, and never in a prone position either.
All right, so for attendees, it's 12:02. If you do need to go, go ahead. We are just gonna be until 12:05. So if you want to hang up 3 more minutes, that'd be great. But you are free to go. Tara asked, I am curious about adding a dog to a session with a client that is not their service dog, but helps with skill acquisition.
So that could be a type of therapy dog. We actually, our local schools do that with literacy instruction, which is kind of cool, with kids that have more significant disabilities as well as reading disabilities. What you're primarily using it for in that case is the dog becomes a reinforcer to the learner, right? The presence of the dog, which means that preference assessment becomes important because dogs are not going to be preferred items for all learners. For some of our learners, they've had paired experiences with dogs that are unfavorable. But if you are engaging in the work, like therapy type work, where you're providing a therapy dog in an instructional setting, it is primarily for reinforcement of the child. It's also a great conversation starter. So if you're working with peer-to-peer communication, speech language therapy, what a great thing for a topic of conversation. For one peer to approach another peer, hey, what's your dog's name? Tell me about your dog. How old is your dog? So you can also use the dog as an opportunity to facilitate some interverbal communication skills.
Fantastic. There is a private question. How would you train a dog to detect seizures?
Great. So we do not do seizure alert dogs. That was not one of the 4 that were there. So I can only speak to what I have read in that and not personal experience. But my understanding, it is very similar to how we train dogs to do hypoglycemia alert. It's through a scent-based system. And I don't have one here, but you know those old-fashioned phone cords when phones actually used to be like connected to a telephone, and people have them now as hair bands. They kind of curl around. I hope this is ringing a bell, right? So we would typically have the individual, in that case, who's diabetic, wear it on their wrist, and the dog is trained to tug on it, much like tugging on this, but a little more subtle. But my understanding is it is very similar. It's a scent-based cue for precursors of seizure alert, but I do not have any experience training seizure alert dogs.
Okay, so it is 12:05. I'm so sorry for those who did not get their answers, get their questions answered. But Rachel, Dr. Potter is very open to answering anything via email. So it's down there at the bottom of your screen. So we will be wrapping up. If you are here for CEUs, once again, you're going to get an email in your inbox with a CEU survey. Make sure to fill that out. And as long as you get 80% or higher on the quiz on there, you will get your CEU certificate. But other than that, we will let you get on with your Sunday. Thank you for joining us. And thank you so much, Dr. Potter, for just spending time with us. This was fantastic. I think everyone really, really enjoyed this one. And it's just fantastic information. Thank you so much.
Thanks for the opportunity. Something I love, so.
All right, so I will close out the room. Take care, everyone.